The mnemonic to remember here is arm, and this is how it works. You're going to take the humerus and split it into 3 sections. Then you're going to label it arm, A-R-M, going from the superior portion to the inferior portion. The mnemonic is easy to remember, just remember arm fracture. And what this does is it allows you to remember common nerve injuries that can occur secondary to humerus fractures based on the location. A stands for axillary nerve, and this will help you remember that a fracture to the head of the humerus can lead to an axillary nerve injury. Remember that the axillary nerve is involved in arm abduction, especially beyond the 15-degree point. R stands for radial nerve. This will help you remember that a fracture to the mid-shaft of the humerus can lead to a radial nerve injury. Remember that the radial nerve is involved in wrist and MCP extension. Lastly, we have M, which stands for median nerve, and this will help you remember that a supracondylar fracture or a fracture to the distal third portion of the humerus can lead to a median nerve injury. Remember that the median nerve is involved in finger flexion. There are also sensory components to these nerves as well. So the axillary nerve innervates the lower portion of the deltoid, the radial nerve innervates the posterior lateral portion of the hand, and the median nerve innervates the anterior lateral portion of the hand. These are just general descriptions of the motor and sensory components of the nerves. We'll go in more detail on this in future videos, but I did just want to briefly point it out.